Hello students, in this question it is being talking about a Sakoshi who is a patient and has a problem with the pregnancy. She can be pregnant and she has been found to be afflicted with endometriosis and is having ectopic uterine tissue growing into the Sakoshi's bladder, and she has her urine is pinkish in color sometimes. And on the basis of this information, we are being asked questions. And the first question is, what disorder is Sakoshi afflicted with? As already mentioned that Sakoshi is afflicted with disorder endometriosis. Another question is, does Sakoshi have endometriosis? What is its function? Yes, Sakoshi has endometriosis, and the endometrium which is the inner lining of uterus generally is thin, but it thickens during the menstrual cycle in preparation for potential implantation of a fertilized egg. Another question asked is, name two classes of hormones produced by the ovary that stimulate the uterus endometrium. The two classes of hormones are estrogen and progesterone. And estrogen helps in the growth and thickening of the endometrium, while the progesterone prepares the endometrium for implantation and maintains that during the pregnancy. Another question asked is, name two hormones from the anterior pituitary gland that stimulate the ovary. What action does each hormone have on the ovary? The two hormones are follicle stimulating hormone, which is so denoted as FSH, and luteinizing hormone, LH. And this follicle stimulating hormone stimulates the growth of ovarian follicle, while the luteinizing hormone triggers ovulation and formation of corpus luteum. Another question asked is, summarize the ovarian cycle. It is the first phase is follicular phase, in which follicle stimulating hormone stimulates the follicle growth, estrogen production increases, and second phase is ovulation, in which luteinizing hormone surge triggers release of egg, and then the luteal phase corpus luteum forms and which produces progesterone. Another question is regarding the uterus endometrial cycle. It consists of menstrual phase in which shedding of endometrium occurs, proliferative phase in which estrogen stimulates endometrial growth and thickening, and secretory phase in which progesterone prepares the endometrium for implantation. And if there is no implantation, then the cycle returns back to the menstrual phase. Another question asked is, what is the most likely reason that Sakoshi has constipation and pain while passing stools? It is due to the presence of endometrial tissue in or around her bowel, which leads to the inflammation and discomfort. Another question asked is, what is the most likely reason that Sakoshi has pink discoloration of her urine? It is due to the presence of endometrial tissue in her bladder, and this presence of endometrial tissue in the bladder may cause mixture of blood with urine and during the menstrual period and cause the pink discoloration. Another question asked is, explain the basis behind the use of oral contraceptives for endometriosis, because these oral contraceptives they suppress the production of estrogen, which is responsible for the growth and activity of the endometrial. So suppression of estrogen leads to the reduced growth and reduced activity of endometrial tissue. This can help alleviate symptoms and may improve fertility in some cases. I hope you found the video useful. Thank you.